Hello everyone, I am Dr. Sneha. I am a fertility consultant at Shrishma Fertility Center, Bangalore. Today I will be talking about the importance of HSG. HSG is a X-ray of the uterus and the fallopian tubes, which is done by injecting a medicated dye through the vagina, and when the dye comes out of the fallopian tubes, then the X-ray is taken. So this X-ray has to be interpreted by the fertility experts. Though the reporting will be done by the radiologist after seeing the C-arm and after interpreting the X-ray, but going through the X-ray film by the fertility experts gives a broader range, and also the subtle changes in the uterus and the fallopian tubes can be picked up. Say for example, the uterus has to look a certain way. The uterus has to look pear shaped. Sometimes what happens, there can be changes in the shape of the uterus. Say for example, there can be dimpling in the fundus of the uterus, that means the top portion of the uterus. Sometimes the uterus can be T-shaped. Sometimes there can be a divider in the cavity of the uterus, which we call as septate uterus. Sometimes the uterus can be double, say for example bicornuate uterus. Sometimes one fallopian tube can be absent. Sometimes the uterine cavity can be banana shaped. So there are lots of variation in the shapes of the uterus which can hamper the successful pregnancy and also the birth of the baby. And also there are changes in the fallopian tubes. The fallopian tubes can be blocked at the initial part of the entry, or it can be blocked at the terminal portion. The fallopian tube can be swollen at certain places. The fallopian tube can be constricted at certain places. The fallopian tube can be very rigid. It can be like a pipe which will not move at all. So it can appear like a rod or a ribbon. And also there can be lot of white spots. We call it as calcifications, which can happen because of the affection from the tuberculosis, which is very common in India. And there can be a lot of changes in the alignment of the fallopian tube and the ovary, which is very crucial, because when the egg is released during ovulation, the fallopian tube has to pick up that egg. So if the alignment of the fallopian tube and the ovary is changed, then there can be problems in conceiving. So lots of subtle changes and also the gross changes can be picked up. Okay, so make sure whenever you do HSG, whatever may be the report given by the radiologist in the diagnostic center, you please carry the film, HSG film, that is the X-ray film, to your treating doctor, that is the fertility expert. A trained and an expert fertility specialist will detect all these subtle changes, and by picking all these subtle changes, your whole treatment modality can change. If your fertility expert diagnoses a certain condition which needs further evaluation and treatment by a procedure called as hysteroscopy and laparoscopy, then it is worth giving it a try, because hysterolaparoscopy diagnoses many conditions which are not diagnosed by HSG. So hysterolaparoscopy is a very simple diagnostic as well as a therapeutic procedure. It's a very simple procedure which is done as a daycare procedure. That means it can be done in the morning and you can get discharged in the evening. So, and the recovery is also very faster, and there is no need of bed rest or long days of leave from your office. So if HSG is abnormal and hysterolaparoscopy is warranted, then you must consider it, because a lot of problems can be diagnosed and treated at the same time, and a lot of people can conceive very quickly. I have seen so many undiagnosed problems during hysterolaparoscopy, and patients conceive within 6 months of tackling that condition after the laparoscopy. So whoever is trying from long time with the normal HSG, thinking that the HSG report was normal, but you are still not able to get a positive pregnancy, then you must show the HSG report to your fertility expert and take second opinion.